Hi, my name's Lori Handy. I'll be speaking to you today from the Vaccine Education Center at Children's Hospital of Philadelphia. Today, we'll be talking about RSV. To start off, RSV stands for Respiratory syncytial virus. It's a virus that we've known about since the 1950s, and it can infect anyone, but it makes our youngest children and our elderly most sick. We're often asked why it impacts these populations. So let's start off talking about our littlest ones. The way that this virus works is it actually can infect the linings of our smallest airways. So first, the virus can do direct damage to the airways, and then our immune system actually makes an immune response against the virus, and there's significant inflammation there. This leads to buildup of material, and that material can make it very challenging for a little child to breathe, as there's buildup of debris, leading to significant coughing and work of breathing. For the elderly, on the other hand, they may have underlying conditions, things like congestive heart failure, COPD, or asthma, that already put them at risk for worse outcomes when they have a viral infection. In fact, up to 10,000 individuals per year die from RSV. So, what can we do about this? Let's first think about some of the preventive measures that we can use to prevent spread between individuals. For our youngest children, we want to cocoon them, meaning surround them by people who are healthy. That's their caretakers or the other children who might be in their lives. If you have a young baby and there's an older child or toddler home from daycare sick, you want to make sure that that older toddler is washing their hands, keeping their germs to themselves, and you're wiping down toys that might move between the two individuals. For our elderly, you want to be just as cautious. If you have a young child who's going to visit their grandparent, keep that young child home if they're not feeling well, particularly during RSV season, and keep that other family member safe. However, there's good news on the horizon for both of these populations. For our babies, we are likely going to have new drugs in development, both monoclonal antibodies and vaccines that will be able to protect our youngest children. And for the elderly, the news is even brighter. We expect throughout 2023 for vaccines to be moving through the rigorous approval process, and by fall for us to have at least 2 vaccines available for this population to make this upcoming RSV season much more tolerable. Continue to check back with the Vaccine Education Center for updates on these topics, and we'll be sure to keep you informed. Thanks for listening today.